welcome everyone. I think we'll get started. So welcome to the first session of the Global Lead Forum that's being hosted by the Global Alliance on Health and Pollution. So wonderful to have everyone here. I'm seeing lots of new names and participants, so really glad you're here to join us today. The Global Alliance on Health and Pollution is a Geneva-based network of international and national level agencies that are committed. You've got put on mute, okay. Let's start over here, okay. So welcome everyone. This is the Global Lead Forum convened by the Global Alliance on Health and Pollution. We are a Geneva, Switzerland-based network of organizations committed to a multi-sectoral approach to address the global pollution crisis and the resulting impacts on low and middle income countries, especially in terms of health and economics. This forum was created as a platform to really bring together a wide range of actors who are typically siloed from each other. So we have on this forum multilateral and bilateral donor agencies, national ministries of health and environment, academia, people from the UN system, from the development banks, professional organizations, nonprofits, and the private sector. So welcome to you all. This forum is meant to be a virtual space for us to exchange knowledge amongst all of our different entities from a wide range of expertise and backgrounds, all about lead, of course. And our aim is principally to build awareness globally about the need to address lead exposures, especially in low and middle income countries. We're aiming to meet about once a month for an hour. And each of our sessions will include 3 to 4 10-minute thematically coherent presentations by a variety of our different actors on this forum that are working to reduce lead exposure on different aspects. So from research through to implementation. And then following these presentations, we will have time for questions and answers. So in terms of housekeeping, if you have questions, feel free to put them in the chat box and we will monitor those. And we will also enable you to raise your hand so you can ask questions directly. We, again, as we're doing this monthly, if you have some work that you are doing on lead and you would like to present here, please contact the organizer. It's Laura Shafley at laura@gahp.net. So I'm really pleased that we're all here today. We couldn't, of course, be here if it weren't for our funders, GiveWell and Pure Earth. This is part of a larger initiative called the Protecting Every Child's Potential Partnership, PECP, and it's really a pleasure today to host a distinguished panelist. And first we have up Drew McCarter to talk about the PEC partnership. So Drew McCarter is leading Pure Earth's global lead programs, which aims to assess and mitigate and prevent children's exposures to toxic lead from unsound industrial activities and contaminated products. Drew has loads of background in this area. He's was a lawyer by training, and he's been doing a lot over 10 years of experience designing field projects, leading environmental assessments, and risk reduction projects. So thank you, Drew, over to you.
Thanks so much, Rachel. As Rachel mentioned, this Global Lead Forum is affiliated with this broader initiative called Protecting Every Child's Potential, and I'm just going to spend a couple of minutes introducing PECP. First, a quick reflection on my own 13 years of designing and managing lead exposure mitigation programs. I have basically seen 3 common challenges or frustrations in this space. The first is that there are great organizations working on this challenge, but we do not coordinate and communicate as efficiently as we could. So coordination is a frustration and a challenge. Second, there are simply too few actors engaged in this space, given the issue's relevance to so many different types of goals and agencies. And then the third challenge or frustration is that there, I believe, are perceived barriers to entry, oftentimes technical barriers. You know, how would I design a lead exposure mitigation program? What are the gaps? Sorry, if people could mute their microphones, that would help a lot. Thank you. So the third barrier is kind of a technical barrier to entry. How do you design an effective program to mitigate lead exposures? And fundamentally, protecting every child's potential addresses each of these three gaps to some extent and is designed to do so. So what is it? In a minute, you're going to hear from Richard Fuller talk about the findings of a report called The Toxic Truth that was published by UNICEF and Pure Earth in 2020. And that report really laid the foundation for creating PECP. It is the kind of knowledge base on which this initiative is built. The purpose of PECP is to realize a future that is free from childhood lead poisoning. And the way that we go about doing that is by increasing awareness of the issue, to bring in more actors, to increase coordination among those actors so that we're more efficient, so that we avoid overlaps and fill gaps. And then by helping new actors enter this space, by reducing that kind of technical barrier to entry that I described, helping people design programs, identify areas that they can engage in. PECP was really established through 2 seed grants from the Clarios Foundation. Clarios is the world's largest maker and recycler of lead acid batteries. The Clarios Foundation provided seed grants to UNICEF and Pure Earth to do 2 things. One was to establish kind of the administrative structure of PECP so that it could effectively communicate with other actors, bring in more actors, and increase awareness. And those grants also enabled the first projects, in-country exposure mitigation projects run by UNICEF and Pure Earth. But although PECP was founded by these 3 organizations, UNICEF, Pure Earth, and Clarios Foundation, by no means is that the end of its size and growth. The intention from the start was to continuously grow it, to bring in more actors. And we do that through a partnership model. There's no fee to get involved. New entrants over the last 2 years have simply had to sign on to a set of 9 guiding principles and then demonstrate some kind of commitment to advancing PECP's goals. And that might be a donation of technical expertise. It might come through financial resources to projects that advance goals. It might be a nonprofit that can simply demonstrate that they have other lead projects that are valuable in contributing to PECP's goals. So any number of ways to get involved and to sign on as a partner. As Rachel mentioned, this forum is a PECP project. There are many others. There are projects that were funded by Clarios Foundation, projects funded by GiveWell and donors associated with GiveWell. USAID contributed to a project in the Philippines, and many other current PECP partners have their own programs that are affiliated with PECP and contributing to a reduction of lead poisoning. We're glad to announce that as of today, we have 9 partners, but in just a couple of weeks, we will be making announcements that a number of major industry associations are joining. So by the time of the next Global Lead Forum, we should have some really exciting announcements about expansion. So I think I won't take up any more time, but I just want to finish by encouraging people to get involved by visiting protectingeverychildspotential.org. There will be a way to reach out to us on that website, or you could simply reach out to Pure Earth, Clarios Foundation, or UNICEF and ask directly how to get involved. But again, we hope that anyone who's interested and active in this space gets involved just to increase the degree of communication and coordination and activity in the space. So thanks, Rachel, and back over to you.
Great, thanks, Drew. So next we have Richard Fuller. He's a global leader on pollution. Many of you know him, of course, an environmentalist at heart, an engineer by training. He is the founder of 2 nonprofits, of course, Pure Earth, formerly known as Blacksmith Institute, and our alliance, the Global Alliance on Health and Pollution. And he's also founded a sustainability consultancy, Great Forest. And you will, of course, know him for the convening and the co-authoring of the groundbreaking Lancet Commission on Pollution and Health. We have an update of that coming out actually next week, so stay tuned for that. And he also authored the book, The Brown Agenda. Rich, please, over to you.
Thanks all. Great to see you all. Welcome. This is a terrific to see this lead forum kicking off. It's such a needed kind of initiative. Arantxa, could you bounce into the slides, please? My purpose today is to give you a brief background on lead and why we need to focus on this at a much higher level than we ever have in the past. As a first step, Arantxa, if you can just, whenever I ping, could you go forward? You all know, I assume many of you know about Pure Earth. We're a nonprofit active in a dozen countries, specifically now focusing on lead exposures. We are very pragmatic in that we like to see real action change on the ground. And we work very closely with a lot of the UN agencies. And with UNICEF, we put together The Toxic Truth about a year and a bit ago. And that really was an extraordinary piece of research because some really extraordinary numbers came out of doing that research. And the first was that 1/3 of all the children in the world are currently lead poisoned. And by lead poison, we mean that their blood lead levels are over 5 micrograms per deciliter, which is the old US standard for government intervention, and still the standard in most of the rest of the OECD countries. So 1 in 3 children have elevated blood levels. That makes lead by far and away the biggest health problem in the chemicals agenda by far. Just an extraordinary impact. And what I'd like to do is just to give you some of what that means in terms of social cost to have this kind of problem occur in the world. So the real basis for this is data from IHME. And you can see countries that are most effective here. This is the average blood lead in countries. And anything that's a red or more is above 5 micrograms on average. So what this means is that 1/3 of all of the children and 1/3 of all the adults, therefore, have brain damage. It's low-level brain damage, especially to the frontal cortex, because when lead is present in developing brains, lead attacks the myelin sheaths and stops connections from happening as effectively as they ought to. And this has profound implications for long-term life. This is why we call PECP protecting every child's potential, simply for that reason, because of the long-term implications that it has. And the first one is that there's a loss of intelligence. 3 to 5 IQ points are lost for this enormous cohort of people out there. There are other implications, especially for adults, where these sorts of exposures cause cardiovascular disease at an enormous rate, almost 1 million premature deaths a year. But this is one nasty chemical that does damage to pretty much every system within the body. If we think about, just the IQ loss from exposure to newly developing brains, you've all probably seen these two graphs. This shows a mean distribution of intelligence, where people who are above 130 are considered gifted and capable of driving forward all of the economic agendas that a country may have. And people below 70 are considered disabled, who need services from family and government. Could you please mute? Thanks so much. If you move that entire slide to the left, you reduce the number of gifted people and increase the number of disabled people substantially. And I think you can consider this another way. 3 to 5 IQ points for an individual doesn't mean much, but at a population level where this is happening right now, for example, half of India, this is happening to half of India. What does it mean to have 3 to 5 IQ points more across half of India? Well, one of the things is it may help people be better at evaluating whether a fact is true or not true. And that may then in turn influence whether people get vaccines. You may end up with more people being vaccinated. You may end up with better results in elections. There are all sorts of implications. This kind of intelligence loss that's occurring as a result of a chemical. If we look at the costs in terms of economic potential, because every IQ point you've lost means you have a lower lifetime earnings. And adding all that up for each cohort of children every year has numbers in it that are astounding, equivalent to 4% of GDP for Africa and 2% in Asia. So this particular toxin at the level that it's exposing people to right now has profound implications. One more implication is the relationship between lead exposure early in life and violent crime when those children so affected become adults. So some new research is underway with EPA, and I'll let some of the other speakers talk around this, but there seems to be a quite substantive link where violent crime reduces as a result of reductions in blood lead levels in those people when they were newborns. We also know that the problem is getting worse, and other folk will talk more about all of this. And of course, what we have to do is we have to get rid of it. To do that, we need to think on where the sources are. Can we go to the next one, please, Arantxa? So from Pure Earth's work, we see these three things as being the main sources of lead: bad car battery recycling, contaminated spices, and dirty and cookware that has lead associated with it, either in the glazing on pottery or lead within aluminum pots. There are other sources too, and they vary from country to country. Obviously, there's lead in paint in some places, cosmetics, so on and so forth. So what we need to do is to come up with strategies to deal with these exposures, country by country, understand where are the hotspots that are occurring in these places, measure and monitor, and find ways to drive those exposures down. Because the implications to society are so extraordinary. If we can increase the level of intelligence of an entire population, we can increase their educational attainment, we can increase their capacity to be productive citizens, we can decrease the level of violence that occurs in these countries, and we can make the whole world a hell of a lot better place than it was before. So that's what's in front of us, and that's why this forum exists. And I'm really grateful you're all here, and we can continue this conversation. I'll turn it back to you, Rach.
Thanks so much, Rich. Next, we have Dr. Howard Hu from the University of Southern California. Dr. Hu is a leading physician, scientist, and epidemiologist who has held very prestigious positions, including as tenured professor, director, department chair, and dean at Harvard, University of Michigan, University of Toronto, and now at University of Southern California. He's currently professor there and chair of the Department of Population and Public Health Sciences in the Keck School of Medicine at University of Southern California. He's incredibly well published and respected in the fields of environmental, nutritional, social, genetic, epigenetic determinants of adult chronic disease and impaired child development in population-based studies. He's been doing loads of research, including out in the field and international. He's leading several COVID-19 cohort studies and many other accomplishments. We're really pleased to have you. Thank you. Please, over to you, Dr. Hu.
Thank you very much. First slide, please. So first, huge congratulations for GAHP for convening this forum. And you just heard from one of the leaders, not only in assembling the scientists, but also in advancing this entire agenda globally. I've had the great privilege of providing some contributions towards the UNICEF Toxic Truth Report, and I would identify that as one of the documents that would be the go-to document for anybody who wants to understand the scientific basis, as well as what the societal implications might be. Can you put up the slides, please? My job today is to explain a little bit more about the science and why we know what we know. Next slide. One of the reasons why you keep hearing from Richard and others that lead is so toxic is because it simply is a chemical the body has not had any developmental experience dealing with. It's called a xenobiotic, a chemical that is not naturally present within an organism. And what it does is that it mimics various elements like calcium in the body, but it doesn't actually fulfill calcium's functions. Instead, it interferes with calcium-dependent processes like synaptogenesis, the formation of brain connections when you're growing, brain function, because calcium is involved in the neurotransmission process, and it also amplifies oxidative damage, which we now know is the accelerant for aging-related processes around the entire body, which is why we're seeing these accelerated degenerative processes in the cardiovascular system, in the brain, the eye, and elsewhere. Next slide. This is from the Toxic Truth document, a compilation of all the different adverse effects you can expect in children and in adults. And they basically coalesce around brain function, the cardiovascular system, the heart and the blood vessels, the blood system that creates new blood, and also reproductive outcomes like spontaneous abortion, birth weight, birth size. Next slide. How do we know this? Well, this is the result of hundreds and hundreds of well-designed scientific studies done in the laboratory on experimental organ systems and in hundreds of really rigorous and increasingly sensitive epidemiologic studies done all over the world. On top of that, there's a process that we scientists go through called systematic review, where we bring all these studies together, weigh all the evidence, and come to conclusions about causality, the dose-response relationship. Just how toxic is this at the very lowest levels of exposure? These are why these documents and these bodies of scientific knowledge are so persuasive and why we must act. Next slide. Now, to just give you a sense of how sensitive the human neurologic system is, these are these dose response curves that are examples of the research that's being done. The graph on the left is a pooled analysis of a number of international studies that were done, which gives you a sense of the increase in blood levels on the x-axis and the decline in IQ that can be expected. And one of the things you can notice is that the declines at the very lowest levels of exposure are much steeper than they are later on. And that's because of the sensitive processes that occur that relate to the things that I mentioned, called synaptogenesis, brain formation. And on the right is another dose response curve from a study my group did, in which we're looking at indices of hyperactivity among children, showing that even at very low blood levels, we can see increases symptoms of anxiety, hyperactivity, inattention. Next slide. Richard mentioned that one of the game changers that might influence even further the policymakers is an assemblage of studies suggesting that lead actually increases aggression and violence. And these are some of the exemplar studies that have done this, and it's still actually subject for systematic review, one that I'm involved with that's being conducted by the U.S. Environmental Protection Agency. Next slide. Unfortunately, there are no treatments. In this study published in the New England Journal some 20 years ago, a randomized multi-center trial of the one medication that does remove lead from the body showed, in fact, no effect on reducing the impact in IQ. In fact, one of the side effects that was noticed of the treatment was that it removed the essential minerals that are needed for growth, and children who received the treatment were significantly shorter. So there are no treatments for lead poisoning and IQ. Next slide. These kinds of studies have persuaded various governmental agencies, like the US Centers for Disease Control, excuse me, to sequentially lower the amount of lead that's acceptable in a child's blood. And you can see here over time how it's gone down. And essentially at this point, CDC has concluded that there is no safe level of lead in which we can't find an impact already on learning and intelligence. Next slide. And as far as adults, what we have seen is that the cumulative exposure over years that happens when you're inhaling leaded gasoline, or you're exposed to lead in water, or all the other sources of lead exposure, the cumulative exposure over time puts you at risk for hypertension, heart attacks, stroke, neurologic diseases. And these are one study that our group did using a special biomarker of lead accumulation in the body, X-ray fluorescence measurements of lead in bone, to demonstrate this effect in epidemiology studies. Next slide. These are the other spectrum of outcomes that we now know are at risk with chronic lead exposure in adults, including these neurodegenerative diseases that are so feared as we enter our older ages. Next slide. So in conclusion, we know a lot about lead's impact on non-communicable diseases. These are insidious effects. You don't feel them. People don't complain about them. But when we do the studies, we can see the impact all along. The treatments for acute poisonings, which chelation does work for, does nothing to reverse the long-term damage in either children or adults. And the overwhelming solution is prevention. Finally, next slide. If we think about where we need to go, some of the very initiatives that GAHP is advancing, preventing lead exposure in children is advancing, can be enacted by understanding the lead exposure situation in your region. Sometimes it requires actual blood surveys in children and pregnant women or adults to understand the spectrum and the distribution of blood lead and the associated exposure. And then, of course, the policies that will reduce that lead exposure, particularly in children and women of reproductive age. Thank you.
Thank you, Dr. Hu. That was really informative. Next, we have Dr. Paramita Hore from the New York City Department of Health and Mental Hygiene. She's an environmental health science within the Bureau of Environmental Disease and Injury Prevention at that New York City Department of Health and Mental Hygiene. And she provides a lot of technical assistance to the Bureau on issues related to characterizing environmental exposures, including environmental sampling and analysis. Dr. Hore also oversees the Bureau's investigations of hazardous consumer products and her investigations with her department have led to the removal of thousands of lead-contaminated products from New York City businesses. So over to you, Dr. Hore. Thank you.
Thank you, Rachel. And good morning, good afternoon, and good evening, based on wherever you are today. It is an honor to be able to present today at the Global Lead Forum among esteemed colleagues. And thank you to GAHP and the funders for making this opportunity possible. As Rachel mentioned, I am an environmental health scientist here at the New York City Health Department, and I oversee our department's work around lead-containing hazardous consumer products. And today I want to touch upon the transnational nature of this problem of lead in consumer products. So how do we identify lead-containing hazardous consumer products in New York City, and what do we do about it? Next slide, please. To give you a brief background, in New York City, blood lead testing is required for certain populations. For example, children ages 1 and 2 years of age are required by law for their provider to give them a blood lead test. Pregnant individuals, when they go to their prenatal visit, doctors are required to be assessing them for lead risk factors and give them a blood lead test if deemed at risk. Workers who are exposed to elevated levels of lead at the workplace are also required by the employer to be for a blood lead monitoring. And we at the New York City Health Department, we receive the blood lead reports for all New York City residents, whether it's children, adults, pregnant, non-pregnant. And this amounts to hundreds of thousands of blood lead reports annually. And we have protocols in place to follow up with cases of elevated blood lead levels. And these protocols involve administration of a risk assessment questionnaire. And as part of this questionnaire, we ask questions to essentially determine what the lead risk factors are for the individual. And questions around product use are also asked. What type of product the case may be using or was using for health or food or spices, etc. And when the investigator deems necessary, finds it necessary to collect samples of suspect products that were mouthed or ingested, they do so. They collect samples and we send them out for lab testing for lead. And next slide, please. And so whenever we collect samples of products, we document product-related information, such as what is the product called, what is it used for, where was the product purchased, etc. And we've been systematically documenting, cataloging this type of product-related information along with the lab results for the lead content for over a decade. And this data, by the way, is available via our website, which is on the bottom left. It's nyc.gov/hazardous products. And we routinely monitor this product testing data along with our blood lead results data. And it helps us to understand who is at risk, at an increased risk for lead exposure in New York City. What are their product associated lead risk factors? Next slide, please. So New York City is a melting pot, and we have people from all over the world who live here. And so through this investigative process, therefore, we have identified a variety of different consumer products found to contain high levels of lead. And these have included products like dietary supplements and traditional health remedies from around the world, including India, China. They may be handmade or manufactured, prescribed, or purchased over the counter, found to contain lead levels as high as 750,000 parts per million lead. We've also seen high levels of lead in spices and snacks from around the world, including South Asian countries, Bangladesh, or the country Georgia, with lead levels as high as 78,000 parts per million lead. We've found high levels of lead in samples of certain cosmetics and religious powders from, again, various parts of the world, including Afghanistan, Pakistan, India, Morocco, found to contain lead as high as 980,000 parts per million lead. We've seen high levels of lead in samples of amulets or tabis. These are products used for good luck, or other jewelry items from around the world, including from Bangladesh, India, Cambodia, Peru, essentially found to contain 100% lead. And the hazard there, of course, is when someone mouths such a product, especially critical for young children who may be mouthing such products more frequently. And then we've also seen really high levels of lead in cookware, metal or ceramic cookware or dishware used for cooking, serving, preparing foods and drinks from, again, various parts of the world, including Mexico, Uzbekistan, Morocco, Ecuador, and Turkey. Next slide, please. So how do we address this issue in New York City? Well, we, of course, inform individuals who are using such products to stop using the lead-containing products. But on a broader scale, once we identify a lead-containing hazardous consumer product, whether it's through an investigation of a lead-poisoned individual or through the literature or a report, we conduct surveys of New York City shops to determine availability of similar products for sale. We go shopping undercover, we purchase samples, we test these products for lead, and if found to contain elevated lead, We take enforcement actions. We take actions against businesses found selling such products. We order them to stop selling. We also forward our findings to our federal partners as they have national jurisdiction. And we have worked with consulates as well to notify foreign ministries of health. And we conduct routine education and outreach activities to raise awareness about such lead risk factors amongst the community. Next slide, please. Of course, enforcement has its limitations, right? Although we have jurisdiction over our New York City and we can take actions against businesses found selling hazardous consumer products, oftentimes our lead poisoned cases report bringing such products from their travels to their home countries from abroad. So that's a major limitation. Next, please. And we also have challenges around risk communication, education, and outreach activities. One of the main challenges is behavior change. People resist to change their behavior around using particularly products or traditional culturally ingrained products that they may have used all their lives. Next slide, please. So despite these challenges, what are we doing? Well, we are continuously collecting this product testing data associated with elevated blood lead levels. And this data provides a glimpse of the different types of consumer products from around the world that can contain high levels of lead. And we're making this data available to our global stakeholders as the change needs to happen at the source. Next slide, please. So how do we address this transnational issue globally? Well, we need data. We need more data, perhaps data, a systematic tracking of product-related data on a broader scale, perhaps national scale, and to help us to support evidence-based regulatory policy changes in the countries of origin. We need buy-in from trusted global health authorities to raise awareness on the issue and relay preventative messages. And then also grassroots mobilization, raise awareness among consumers and encourage them to advocate for safer consumer products. Next slide, please. So I thank you for the time today. This is an important global health issue, and the dialogue will be ongoing. Thankful to be part of this dialogue. Back to you, Rachel.
Thank you, Dr. Hurries. Great, good to see all of that information. And it's enormous, the amount of products you guys are coming across that are lead contaminated. Next, we're really pleased to have Dr. Martijs Rojo from the Institute of Public Health Mexico. She has her doctorate in epidemiology from she's published more than 250 papers, and her main focus of research is the study of long-term effects of the co-exposures of environmental toxicants and nutritional conditions during gestation and infancy. More recently, her work has been focused on the impacts of health policy of lead exposure in Mexico. So please, Mara, over to you.
Thank you, Rachel. Good morning, good afternoon, good evening, everyone. First of all, a big thank you for Laura and for all the organizing committee of the Global Lead Forum for the invitation. The story that I will present today was only possible to the partnership of key actors as Pure Earth, Mundo Químico, and a wonderful team at the National Institute of Public Health. Arantxa, can I have the first slide, please? Next one, please. Thank you. The story of lead clay ceramics in Mexico was first documented in early 19th century, and the first documented case of lead poisoning was published in late 19th century. This paper has very interesting ideas, as calling lead as the slow poison, and ends with a shocking statement. This could be avoided if the authorities prohibits the use of varnish in pottery that will be in contact with food substances. Almost 150 years later, we're still talking about this. Next one, please. For those who have visited Mexico, I'm talking about this beautiful pottery that is used very frequently in our delicious cuisine and is deeply embedded in our culture and at all socioeconomic levels. Next, please. It is produced in domestic kilns that does not reach the temperature that is needed to fix the lead into the pottery, making it a great risk to the artisans that produce it and to the population that use it for cooking and to serve meals. We have about 30,000 to 50,000 domestic workshops all over the country. Next, please. Since 1997, Mexico has a completely lead-free gasoline. And this has led into a very strong decrease in lead in air, as you can see in this graphic. Next, please. Thank you. As you can see in this graphic, children's blood lead levels has also decreased. However, next, please. As you can see here, next, please. There is a plateau that suggests the source of exposure widely spread at the population level and not specific to the research population from Mexico City. Next, please. With this in mind, we developed our first project in general population. Given that we didn't have funds for this project, we designed the most non-expensive study that could provide information on lead poisoning in general population and on one of the most vulnerable population in terms of prevention for long-term effects, newborn. We conducted this study in Morelos State, where the National Institute of Public Health is located, and where there is a very strong tradition of using lead glazed ceramics. Next, please. Results were clear. There was a prevalence of newborn with lead poisoning around 50%. We also documented that almost 60% of the mothers use lead glazed ceramics during pregnancy, and among these, almost 70% use it daily. Babies' blood lead level were positive associated with mothers' frequency use of this pottery, as you can see in the graphic. If we see the prevalence of the moms that did not use this kind of pottery, the prevalence is comparable to the country with a lead control policy in place. Next, please. This result brought the authorities' attention, and with the partnership with Pure Earth, we were able to bring this topic to the Ministry of Health at the federal level. With them, we were able to include the measurement of children's blood lead level in the National Survey of Health and Nutrition Survey in 2018. Would you please close your mic? Thank you. Oh no. Thank you. Next, please. This survey was national representative, but also regional representative, and allow us to document that the national prevalence of children's lead poisoning 1 to 4-year-old was 22%, which represented 1 million kids. This particular survey was representative of municipalities with less than 100,000 inhabitants. So these numbers correspond to this kind of population. But we also documented important regional differences. As you can see in the graphic on the right, the southern part of the country reached a prevalence of almost 40% of lead poisoning, but with a strong contribution of use of lead glazed ceramics, as is marked in the dark part of the green bar, and with a lower, considerably lower prevalence of poisoning in the northern part of the country, as you can see in the blue bar. Next one, please. With these results, we were able to get into what I will call, please allow me, the large national health survey of nutrition, which is not only national representative, but also representative at the state level of the country. So we were able, our goal here was to estimate the prevalence of lead poisoning, meaning poisoning, blood lead levels above 5 micrograms per deciliter in 1 to 4-year-old children in Mexico in the 32 states of the country. Next, please. From this project, we were able to estimate that 70% of the population at the national level of 1 to 2-year-old children were lead poisoned. There was a strong heterogeneity within the states. As you can see in the right part of the graphic, there were states as Puebla that were almost 50% of the children had blood lead levels considered poisoning. It was followed by states in the center as San Luis Potosí or Tlaxcala that reached almost 40%. But also we found a very heterogeneity puzzle in the country where there were states as Sinaloa or Tabasco with almost no prevalence of lead poisoning in the country. Also, we documented that the contribution of lead clay ceramic was very different. As you can see here, next one, please. The red part of the bar shows the part of the prevalence that use lead clay ceramic, but the blue part of the bar represents other sources of exposure that we are working on now. Next one, please. These results, and with the contribution of Mundo Químico, an organization in Mexico, were able to bring attention of the National Board of Health. And in 2019, it was approved the national program to control lead exposure in Mexico. It was classified as an immediate action program. This program was organized in 5 axes. The first one that would review the regulatory package. The second one that would propose a clinical case management of lead poisoning cases. A third one that would work on the replace of the lead in the glaze for the ceramic. The fourth one that would develop an epidemiological surveillance of lead in blood. And the fifth one, a health promotion component. Next one, please. These days, we have been able to make improvement in these 4 components that are marked in green. And we have developed, we are reviewing now with the authorities, the regulatory package. The protocol for clinical case management is now developed and approved. The epidemiological surveillance component has been developed and approved. And there are several actions of the health promotion component. However, we have been quite slow in the implementation phase of this national program. Honestly, competing with resources in these COVID times have been challenging, but we will not give up. Thank you very much.
Thank you very much, Dr. Rojo. This is a lot of information we're throwing at you. So please, I'm sure you all have questions. Please use the chat box to put those in. So this is what you've seen and heard today is years and years of research, more than 100 years of research, as Dr. Rojo has pointed out. And it's years of expertise and years of studies, coming at you in less than an hour. So don't worry, you can rewatch all of these presentations again and share them. We'll have them up on our YouTube channel, as well as on our website, which is www.globalleadforum.org. So I just want to take you through kind of these big key takeaways. First of all, we're hearing that lead pollution, which is this very ancient thing, even dating back to the times of the Romans, has an enormous global impact today, such that 1 in 3 children are lead poisoned. We heard from, and that was from Mr. Fuller's presentation, and from Dr. Hughes' presentation, we're really hearing about the huge impact that this has on non-communicable diseases, on children's health, the irreversible damage that has potentially huge impacts beyond just death and disability, but this is really reducing generations of children's potential, and that ends up coming back to haunt us years and years later in the forms that are really nightmares for policymakers. The sources are many. So Dr. Jorge was presenting some of the many different sources from South Asian communities in New York City that we're seeing, and from the Latin American community. And Dr. Rojo is really showing us, well, here's what we found in Mexico. Here's what we're able to do when we have some really good data about not only what age groups are being affected, but where the exposures are happening. And that allows decision makers and policymakers to really understand the challenges that they're facing, and also then therefore to start to take action. So those are the kind of key takeaways that I found. And so I see now that we're starting to get some questions in the chat. So let me go to the first one here. Dr. Hugh, thank you for your presentation. Lead is in the group 14. There's different lead and calcium are different elements on the periodic table. So what is it about these two elements, lead and calcium, that are causing them to mimic each other in the body? So kind of getting into the technical aspects on that. And is there anything that can be done using bonding with lead to make it inactive in the human body? So two questions there, very technical in nature.
Hi, I actually responded in the chat, but clearly lead interferes with a number of different enzyme, transporter, and other molecular processes because of its status as a divalent cation in the body, and as such, it interferes with processes not only related to calcium, but also zinc, iron, magnesium. We see this, for instance, in some of the nutritional interactions that Martijs Rojo mentioned, where if your diet is deficient in iron or magnesium, you'll absorb more of the lead from your intestines because of the transporter system NRAMP2. It's a molecule that's responsible for bringing in some of these dietary cations into the body.
Thank you, Dr. Hugh. Next question, is there any research to influence policy to reduce lead production from mining activities? If not, why has the government not stopped production of the poison? So I can answer a couple of those questions unless some of the panelists would like to tackle these. I can't actually see, so please unmute yourself if you've got something to respond there. Okay, one of the things that the Global Alliance on Health and Pollution is seeing is that the sources vary really very much by country. So mining is certainly an issue in Latin America. We just heard about a new issue where there's lead exposures coming from oil extraction, not just the actual mining of lead itself. Also another exposure related to lead mining would be actually on the other side. So instead of actually mining it from the earth, kind of doing secondary lead smelting, that's another big source of exposure. So I think governments have a particular challenge to try to find out what their main sources of exposure are for the population. And the reason why they're not going to stop it is, well, lead is super, super valuable. It's a huge commodity and it is not going away anytime soon. About 85% of lead is used in the production of lead acid batteries. Okay, every single car, truck, vehicle has these batteries, including electric vehicles. There just is no other better battery storage use for vehicle transportation. It's also used in telecommunications and solar panels and many, many different installations. It's used as the backup for backup electricity in many homes and hospitals and others. So this is a really big product. That it's not going to go away. We need to be able to manage it properly, and it can be done in a way that's safe and very circular economy. Okay. A question to Dr. Tejas Rojo. You indicated that in some cases, lead glazed ceramics may not have actually been the major source of exposure in Mexico or maybe parts of Mexico. Do you have ideas about other sources?
Well, thank you for the question. It is a great question and a very challenging question. The reason because we focus on lead glazed ceramics, it's because it's deeply embedded in our culture. As I mentioned, at all socioeconomic levels, we have documented that is the most important source of exposure. However, as I mentioned in the graphic that I showed, now we can say that it is not the only source of exposure. We know that it could be a wide variety of other sources like recycling batteries, maybe some tubes for transporting water. It could be paints. It could be a wide variety. We now want to address that question. As I mentioned, it's challenging. We will be part of the next national survey of health and nutrition that it will be conducted this year again. And we will try to ask about other sources of exposure. We have focused our efforts in lead glazed ceramics because we think that is the most important, but the next step is to address other sources of exposure.
Thank you. We have lots of questions. I see things are popping up on the chat. This is really great. I'm glad that the questions are starting to flow. We have reached 11 o'clock, but I think we'll take a couple more questions. So we have here a question for Dr. Jorge. Thank you for your presentation in which you spoke about testing children ages 1 to 2 and also specific other populations. Is there a reason why surveillance for children has not been done over a wider age range?
Hi, thanks for the question. So just to clarify, by law, children ages 1 and 2 are required to be given a blood lead test, and doctors are also supposed to assess for lead risk factors for children up to age 6. However, the general message from the health department is if you have lead risk factors, get a blood lead test, whether you're a young child or older adult. And something else to add to that, why younger children versus required by law and testing during pregnancy. At least for children, one of the main identified risk factors within New York City for lead exposure are lead paint hazards. And younger children who are closer to the ground are more likely to get exposed to lead paint hazards. So I hope that answers or clarifies the question.
Thank you, Dr. Jorge. We'll take one last one that I see here. A comment. I'm often frustrated that few low and middle income countries have been able to do population blood lead level surveys, and very few have blood lead level surveillance or screening programs. What are their obstacles to establishing these programs, and how can we facilitate creating them? Would any of the panelists like to take that question? Otherwise, I'll go to Mara, please.
I can go. Yeah. I thank you very much this question. I think that for us, an important first step was to generate general population information and being able to say this percentage of prevalence of elevated blood lead levels or lead poisoning is the prevalence for children, for newborns. That brought a very important attention from the health authorities. Now the big challenge is to make this program a reality. And the big challenge is resources, absolutely, financial resources. We may have the political will, but the resources is a big challenge. The way that we are trying to tackle this is to design a surveillance system that could be in two ways. One part through health surveys that could bring us a population level information, and another with an individual health system, health surveillance, particularly in the states where the prevalence of lead poisoning is the highest. The reality that Paromita described in New York would be our goal, but our country cannot face this kind of program. This is the way that we are tackling this. I hope that this could help for this very good question and very challenging one.
Absolutely, that is one of the big challenges. Getting funds, getting awareness within different ministries to even know that lead is an issue. Everyone's pretty much thought we've solved it. We had a big announcement last year with lead in gasoline being finally stopped in production in many countries. So I think that's really all we have time for today. Please, again, if you are interested in speaking or contributing, please contact Laura Shafley, laura@gahp.net. I would like to express my thanks to our donors, GiveWell, and also to all the panelists here today for your really scintillating presentations. I think we all are learning a lot, and we have generated some really good discussion to move forward. So stay tuned. We'll have another meeting soon, another really exciting lineup for you. Please continue with the engagement, send us comments, questions. We're really looking forward to engaging you all and to generating a really exciting movement to stop childhood lead poisoning globally. Drew, do you have any final remarks from PECP?
No, I just want to thank you, Rachel.
Yeah, it's been really great. Thank you all to the organizer. Thank you, Laura and Arantxa and everyone else. It was really great. Lots of messages happening. Please continue the conversation. Thank you so much.
Thank you. Take care.
Thank you.